Hey everyone, welcome back. Today, we're talking about something every senior, retiree, Social Security recipient, SSI recipient, SSDI recipient, Medicare beneficiary, Medi-Cal recipient, Medicaid recipient, SNAP recipient, and person living on fixed income needs to pay attention to right now. Could seniors be missing money? Because this week, the big question is not just, will Social Security checks go up? The bigger question is, are seniors missing benefits that they have already qualified for? Are Medicare costs eating up the increase? Are SSI recipients missing help? Could Medi-Cal or Medicaid paperwork affect coverage? And at the end of the month, how much money do seniors actually have left after everything is paid? Now, I want to be clear right now from the beginning. I'm not saying everyone is getting a new check tomorrow. And I'm not saying that every single senior qualifies for extra money automatically. And I'm not saying every proposal or update applies to every single person. But these are important money updates to watch because they could affect your benefits, your monthly costs, your health care, your eligibility, your paperwork, or the money you have left in your pocket. Also, quick reminder, this is not financial, tax, medical, or legal advice. I am just simply breaking down the latest updates in plain English so you know what is happening and what to watch next. Let's get right into it. The first topic is seniors may be missing benefits that they already qualify for. First, we need to talk about one of the biggest money alerts for seniors right now. A recent update from the National Council on Aging says that more than 9 million eligible older adults may be missing out on benefits that could help with food, health care, Medicare costs, and basic expenses. And the estimated value of those unused benefits is about $58 billion. That is huge. Because a lot of seniors are asking if more money is coming from Social Security. But for some people, the money may already be available through programs they are not enrolled in. We're talking about programs like SNAP, SSI, and Medicare Savings Programs. SNAP, for example, can help with groceries. SSI can help low-income seniors and disabled beneficiaries with monthly cash support. Medicare Savings Programs can help some people pay Medicare premiums, deductibles, coinsurance, and other costs. And this is where seniors need to pay attention, because more money does not always come as a brand new Social Security check. Sometimes more money comes from benefits that already exist. Sometimes it comes from lowering grocery costs. And sometimes it comes from getting help with Medicare premiums. Sometimes it comes from qualifying for SSI. Or it comes from reducing the bills that drain your check every single month. Now, this does not mean that every single person qualifies. Eligibility depends on income, assets, household size, state rules, and the specific program. But if millions of eligible older adults are not enrolled, that means a lot of people may not even realize that they should go and check those things. And that is the first major money alert this week. Do not only ask whether a new check is coming. Also ask, am I missing benefits I already qualify for? Because for some seniors, that could be the difference between falling behind and getting some breathing room. The second topic that is here on the table. Social Security and SSI benefits are up, but costs still matter. For 2026, Social Security and SSI benefits increased by 2.8% because of the cost of living adjustment. That affects about 75 million Americans. Now that sounds like good news, and for many people it is. But here's the part that seniors need to watch. A benefit increase does not automatically mean seniors feel ahead. Because if groceries, rent, utilities, insurance, prescriptions, Medicare premiums, and other costs rise as well, then the increase can disappear quickly. That is why the real question is not just how much did your check go up? The real question is how much money do you have actually left after everything is paid? For SSI, the federal payment standard for 2026 is $994 for an individual and $1,491 for a couple. That is important, but SSI recipients still deal with strict rules, income limits, resource limits, reporting requirements, and paperwork concerns. And for Social Security recipients, a higher benefit may still not feel like enough if everyday costs keep rising. This is why I keep saying more money can come in different ways. A Social Security increase is one way, an SSI increase, lowering Medicare costs, SNAP benefits, Medicare Savings Programs, tax relief, avoiding paperwork mistakes is another way that people lose money without even realizing it. The goal is not just a bigger number on paper. The goal is more money left over at the end of the month. So this week's second update is very simple. Social Security and SSI benefits are up, but seniors still need to watch whether rising costs are taking that increase right back. Topic number 3. Medicare costs can eat up Social Security increases. Now, let's talk about Medicare, because a lot of people focus only on whether Social Security checks are going up. And of course, bigger checks do matter. But what good is a bigger check if Medicare costs, prescriptions, doctor visits, insurance, dental, hearing, vision, and other health costs take the increase away? For 2026, the standard Medicare Part B monthly premium is $202.90. The Part B deductible is $283. That matters because many seniors have Medicare premiums taken directly out of their Social Security check. So even if your gross Social Security benefit goes up, the amount you actually keep may feel smaller after Medicare costs. And this is why Medicare is not just a healthcare issue. It is a money issue. Every dollar spent on premiums, deductibles, prescriptions, or doctor visits is a dollar that cannot go toward groceries, rent, utilities, transportation, or family. So seniors need to watch Medicare news just as closely as Social Security news, because sometimes more money does not come from a bigger check. Sometimes more money comes from lower costs, lower premiums, prescription costs, better access to care, fewer surprise bills, more help through Medicare Savings Programs, less money being taken out before you even see your check. And this is why this topic actually matters. If your Social Security check goes up by $50, but Medicare, prescriptions, groceries, or rent go up by more than that, you are not actually ahead. So the Medicare takeaway is this: a bigger Social Security check only helps if seniors actually get to keep more money after health costs. Topic number 4. Medi-Cal and Medicaid paperwork could affect coverage. Now, this is especially important for people in California, but it also connects to a bigger national issue around Medicaid coverage, eligibility, paperwork, renewals, and deadlines. California's Department of Healthcare Services says there are federal changes affecting Medi-Cal eligibility rules. Some of the changes involve eligibility processes, immigration status categories, and future work or community engagement requirements for certain adults. Now, this is important. These rules do not affect everyone the same way. Some requirements apply to adults aged 19 to 64 without children under 13, and exemptions may apply for pregnancy, disability, and serious health conditions, among other circumstances. So seniors aged 65 and older should not panic and assume every rule automatically applies to them. But Medi-Cal and Medicaid changes still matter because many households include seniors, disabled adults, caregivers, adult children, and family members who rely on health coverage. And even when benefit amounts do not change, paperwork rules can affect people. Renewal notices matter, eligibility checks, deadlines, missing paperwork, coverage categories, and for people living on fixed income, losing health coverage or having a coverage disruption can create major financial stress. That is why this is a money issue. A person can receive Social Security, but if health coverage changes, prescriptions cost more, doctor visits cost more, or paperwork gets missed. That can create a serious problem. So the final update this week is this. Medi-Cal and Medicaid changes may not mean a bigger check, but they can still affect money because health coverage protects people from costs they may not be able to afford. So if you or someone in your household relies on Medi-Cal or Medicaid, watch your mail, watch your notices, watch renewal deadlines, and do not ignore paperwork. Because sometimes the biggest financial risk is not missing a new check. Sometimes the biggest risk is losing a benefit that was already helping you survive. So let's quickly recap the 4 money updates seniors need to watch this week. Number 1, millions of eligible older adults may be missing benefits they already qualify for, including SNAP, SSI, and Medicare Savings Programs. Number 2, Social Security and SSI benefits increased in 2026, but rising costs can still eat up the increase. Number 3, Medicare costs can reduce how much seniors actually keep from their Social Security check. And number 4, Medi-Cal and Medicaid paperwork, renewals, and eligibility rules could affect coverage for some households. So the big picture is this. Seniors are not just asking for political updates. They are asking, am I missing money? Will my check go up? Will Medicare take the increase away? Could SSI help me? Could SNAP help me? Could Medicaid or Medi-Cal paperwork affect my coverage? And how much money will I actually have left after everything is paid? That is what matters. Going forward, this channel is going to keep watching one question above everything else. What could affect the money seniors actually have left? Not just political noise, not confusing government language, but what could affect your check, your benefits, your healthcare costs, your eligibility, your paperwork, and the money left in your pocket. If this video helped you, please hit the like button, subscribe, and share it with someone who receives Social Security, SSI, SSDI, Medicare, Medi-Cal, Medicaid, SNAP, or retirement benefits. I will keep watching the latest developments and breaking them down in plain English. Thank you so much for watching, and I will see you in the next video.